Hello and welcome to another episode of Psych and Sex Sundays with Dr. Sonya Maya. Here is a channel where I talk about spicy time facts, relationships, and psychology. So if you like that kind of content, please do make sure to stay tuned. And today I want to talk about a few ways that ejaculation and orgasms can actually decrease your risk for cancer, regardless of the type of equipment you have down there, the tools, your love muscle, your vulva, not the Volvo, the vulva. Doesn't really matter if you have a peen or a vajayjay. When you pleasure yourself more often, you are at less risk for certain types of cancer. So let's talk about it. So yeah. How does pleasure keep you healthy? I don't know if you know this, but apparently prostate cancer impacts 1 out of 8 men. That is a lot. So if you think about it like this, there's approximately 158 million men in America. And according to ChatGPT, that means almost 20 million men in America could be at risk for prostate cancer. Yes, math. Thank you, ChatGPT, for this. If you are unaware, the function of the prostate is to make the semen, the fluid that makes up semen. The muscles of the prostate make sure semen is forcefully pressed into the urethra and expelled out during ejaculation. Side note, the younger you are, the more forceful your ejaculation is. So as you get older, the forcefulness goes down. But if you have a stronger pelvic floor, you will have more of a forceful ejaculation. So strengthening your pelvic floor through pelvic floor exercises or through orgasms, it sounds a lot more fun. That can actually increase the forcefulness of your ejaculation if that's something that is important to you. Yeah, if it is, if it isn't. Yeah. More info on the pelvic floor at the end of the video, so make sure you watch until the end for that great information. There are a couple different theories for why ejaculating more often can decrease the risk for prostate cancer, and one of them is over time, if you are not releasing fluid, it actually builds up in the prostate, and this is known as prostate stagnation hypothesis. According to research, you can get carcinogenic secretions over time that increase the chances for cancer the more you let your ejaculation build up, which is something that I suspected when I was thinking about it. It's like, okay, you're not emptying out the engine, therefore, maybe there is a bit of like a backup. So yeah, if you don't clean out your ejaculates, then you can get carcinogenic secretions over time that increase the chances for cancer, promoting cancer cells. So that's interesting, right? And that makes sense. If you think about it, got to clean it out. And then therefore you can avoid the carcinogenic cells. The other theory is that psychologically there's less stress. I talk about this all the time, but the more ejaculation you have, the more orgasms you have, the less stressed you're going to be. Cortisol decreases the more that you have oxytocin release and other feel-good hormones. Therefore, maybe there's less stress, because if you are very stressed out, you're going to be more at risk for health issues such as cancer. So the more ejaculation you have, or that you are potentially managing your stress, regulating your emotions, emotional support, wanking, right? So yeah, that makes sense too. So psychologically, so it could be related to the emptying out, so the prostate stagnation hypothesis, or it could be related to the decrease of the stress hormone cortisol, or maybe it's a little bit of both. Let's talk about a great study that was done in 1992, which happens to be the year that Dr. Sonya Maya came to be as well. That is the year that I was born, August 13th, 1992. It's a great study because it measures information over a long period of time, which is really nice. A survey was done for over 29,000 men, and they answered questions about their ejaculation frequency per month. The participants were aged 46 to 81, and in the surveys, they were asked about the average amount of ejaculations that they had during certain age ranges. For example, how many ejaculations do you have per month between the ages of 20 and 29? And how many ejaculations did you have per month between the ages of 40 and 49? Also, the most recent year. So they gathered a lot of data, and the ejaculations could have been from sexual intercourse, from nocturnal emissions, wet dreams, from masturbation, because let's not forget, you don't need to have more sex in order to decrease the chances of prostate cancer. You just need to have more ejaculations, which you can achieve on your own. Having sex with yourself is the best form of self-care, which is why I think when people say, go F yourself, is that really an insult? I mean, Not in my book. Also, by the way, the volunteers provided comprehensive health and lifestyle data every 2 years until the study concluded in 2000. So they had 8 years of comprehensive health information, and they were looking into if ejaculation frequency had some type of association with a lower risk of prostate cancer. From the study, they found that ejaculation frequency decreased with age. I mean, that makes sense, like less testosterone and maybe less in the mood for, that kind of thing. But let's change that. Doesn't matter how old you are. Make sure you're taking care of your needs. You know what I'm saying? Because older people can have great sex too. Because if you think that older people are not entitled to pleasure, then you are wrong. So what they found from the study was that 57% of men between the ages of 20 and 29 ejaculated 13 plus times a month. And 42% of men between the ages of 40 and 49 ejaculated 13 plus times a month. They compared that with those who finished 21 plus times a month. And by the way, if you are ejaculating 21 or more times a month, that's about like 5 per week. So that's a pretty healthy amount, and we'll explain why. That might be a lot, because it's like, okay, if you ejaculate every weekday, if you could think about it like that. The biggest takeaway from the study that I want you to remember and jot down on paper or in your brain, depending on your long-term memory storage, is those who ejaculated 21 plus times a month were 20% less likely to get low-risk prostate cancer. Mind-blowing. This is a great study with great data. It considers a lot of variables, so definitely keep that in mind. And I love this study so much. And by the way, every time I talk about increased masturbation leads to decreased chance for cancer and issues with your blood pressure and issues with heart failure, etc. People in my comments are always like, I'm gonna live forever. I guess I'm doing great then. And I love that for you guys. I really do. Let's talk about vulva owners, vagina owners, breastitis owners. People who have vaginas and breastitis. I don't know why I say breastitis. I'm just weird like that. It's okay. So here's what the research shows. Women or vulva owners who have more orgasms are less likely to get certain types of cancer, such as breast cancer, which is a very common one, because having more orgasms leads to increased oxytocin. Studies show that an increase of oxytocin leads to less chances for cancer. And there's been some mice studies showing this as well, that oxytocin can decrease the volume and weight of tumors in mice breast cancer. So mice have breasts too, and they get breast cancer. Something I don't usually think about, but now I'm going to be thinking about that. Research also shows that, of course, when you have more orgasms, you're going to have better sleep. You're going to be in a better mood. I don't even have to say this anymore because I talk about it all the time, but better mood, less cramps. The list goes on and on. I did promise that I would talk about pelvic floor, so let me talk about pelvic floor again. I think this is really interesting how the stronger your pelvic floor is, the better your orgasms are going to be. But it also works the other way. So the better your orgasms are and the more orgasms you have, the stronger your pelvic floor gets. So it kind of like goes in a circle. They both help each other out, They go hand in hand. So use your hands for the hand in hand benefits. Yeah. I had to throw a punny type of joke in there somewhere. Anyways, not only are you going to have better pleasure when you have improved pelvic floor strength, a pelvic floor that is strong means that you're going to have better bladder control. It helps you with your ooh-wee, Mr. Poopy butthole.
Ooh-wee, 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 ooh-wee.
Yeah. It helps you poo regularly. The proof is in the poo, as people like to say when they talk about probiotics.
Ooh-wee.
The reason this works is because the pelvic floor muscles need to relax in order for the stool to move through the exit. And the healthier your pelvic floor is, the more you're going to be able to relax it. Apparently 50% of people with chronic constipation have pelvic floor dysfunction, which is an impaired relaxation and coordination of the pelvic floor and abdominal muscles. Better pelvic floor, better orgasms, better pleasure. You're going to pee better over time, and you're going to have less poopy problems. Don't got to deal with as much shit. You're welcome. So that is it for Psych and Sex Sundays. I really hope that you learned something new in this video. Please share it with somebody that you care about, because this video does apply to everyone. It doesn't matter what kind of junk in the trunk you have. You are going to benefit from more pleasure. Okay? That's it. That's my message in this video, health-wise and psychologically. That's what this channel is about, improving your psychological health and your physiological health. This isn't my dog, by the way. It's my roommate's family's dog, but She's so beautiful. I had to feature her in the video because I'm hanging out with her today. Lucky me. Everyone, please make sure to make pleasurable cli-cisions and decisions because you are deserving and worthy of great health and mental clarity. I will see you next week for another video. Goodbye.